नमस्ते शारदे देवी वीणा पुस्तकधारिणी विद्यारंभम करिष्यामि प्रसन्नां भव सर्वदा. हरि ओम. Good evening all. So today let us start with some cases. Basically, this is a case of say 37 years old patient, and he came with say mm, low back pain, no surgical history. First episode of low back pain that he experienced was occurred about say 10-12 years ago, and it was very minor. It lasted for approximately say 8 to 10 days, and uh, because he lifted a heavy box from the back of a van. Basically, his father was massagist, so he gave him massage treatment for 3-4 days, and he became asymptomatic within say 8 to 10 days. He went back to his work without any low back pain, and mm, after that, the present complaints after 10 years, the present complaints are constant low back pain, which radiates to left and right upper buttock region. Many a times, pain radiates to left buttock, then to thigh, then to calf posteriorly, and experiences tingling sensation in uh, mainly in left heel. Uh, Very less frequently, pain radiating into posterior aspect of right thigh also up to say knee. Say if he drives car for say approximately 1 or 2 hours, anterolateral part of left thigh develops an aching pain. No night pain. Uh, Maybe he gets awakened with night pain uh, while changing position also. Then say sneezing or coughing. Uh, it doesn't aggravate his leg pain, low back pain, etc. So this is the basically present uh, symptoms of him. Around say pain radiates up to right lumbar spine and experiences low back pain on walking up stairs. While climbing up the stairs, he experiences increase in low back pain. This is what is patient is describing. Arising from seated position aggravates his low back pain. He finds it very difficult to straighten his low back after bending forward. uh, he went to a general practitioner who gave him, say, NSAIDs, non-steroidal anti-inflammatory drugs. Uh, it may help him or it may not help him. And Uh, that's it. So this is the basic history of this male 37 years old male patient. Yesterday, someone asked me about the treatment. But remember, my dear friends, treatment is not that difficult. Difficult part, the main part of a practitioner is pinpoint diagnosis. So it is very much important that you go for a pinpoint diagnosis. Then only it will be possible for you to do this type of treatment. Around say 10 11 months ago, patient lifted a heavy box uh, which caused gradual onset of low back pain. But say on the second or third day, it was say very much painful. So that is the basic point. This case is a simple case of intervertebral disc protrusion. Lumbosacral disc thinning is there, plus anterolisthesis is there. So of L5 over S1, anterolisthesis is there. So lumbosacral disc thinning and anterolisthesis, it is prolapsed intervertebral disc. So this particular case is IVDP or intervertebral disc protrusion. Mainly only with the help of say X-ray and afterwards say MRI, you can diagnose this case. There are clinical tests also, and that confirms this type of diagnosis. So afterwards we will be talking on clinical tests also. So this was the clinical picture, and this is in this second case. This is a fantastic case. Patient came with say this is a case of 40-year-old man who was a very good gym person, and he was running regularly. Nowadays you can see many people who runs in the marathon also, and they run very regularly. So this patient was having psoriasis, and from maternal side, there was a patient of rheumatoid arthritis. So even his mother was having mild rheumatoid arthritis, grade 1 or 2, say grade 1 or 2. So this was a very peculiar case. Low back pain of about say more than 4-5 years duration, and it was worsening in cold weather. If he sleeps on a soft mattresses, then it aggravates. Sometimes he was having severe low back pain. Occasionally, running causes low back pain. But he was a very dedicated runner. So though paining is there, he was running. Lifting heavy items did not cause him increase in low back pain. Remember, word to word. These are all the points related to diagnosis only. If a patient comes to you with lifting reasonably heavy items and he causes pain, then it is mechanical pain, then it must be intervertebral disc prolapse. If a patient of say this type comes to you and he lifts some heavy objects and still he is not getting severe low back pain after that, or he is not or pain is not aggravating at that point, then it is not a mechanical deformity, it is inflammatory disorder. So no night pain was there. And only 5 years history was there. Severe low back pain is his the main complaint, and the picture of pain is like this. Picture is like this. So now this is thin bridging osteophytes. So X-ray shows rheumatoid arthritis. How? Thin bridging osteophytes are at L2 and L3 level, and sclerotic changes anteriorly. Sclerotic changes were there. These are black arrows. It shows sclerotic changes, and thin bridging osteophytes are there at L2 and L3. So this is a peculiar picture of say rheumatoid arthritis. So according to that, one could diagnose it is seropositive inflammatory arthritis. Then we went ahead with say some pathological blood tests, and then the diagnosis was confirmed. After that, we started treatment related to rheumatoid arthritis, and patient was relieved from the pain. Patient was given some counseling plus education, and patient was all right afterwards. So this was a fantastic case related to that. Only Cortisol. We are talking about only Cortisol, and there are n number of different diagnoses are there. Along with the diagnosis, treatment will change. Remember this. See, a female patient of 30 years old comes to you having 2 kids and having past history of LSCS done 2 times. Appendicectomy was there around say 8 to 9 years ago, and 2 LSCS were done. So she was having constant chronic low back pain, and it was central to right sided, which includes sacroiliac joint. This pain radiates into right buttock, right leg posteriorly, into the sole of right foot. Pain prevents her from playing with her kids, and she was unable to do normal household activities because of constant aggravation of low back pain syndrome. Appetite was reduced, and uh, but she lost around 5-6 kg weight during last few weeks. So it was a very strenuous situation for her. Every time uh, she was telling that my husband is got tired of my pain, and she was very confused why any doctor cannot reduce her pain. That was the case. Uh, many neurological related investigations were done for, say, intolerable pain. So, but it was in vain. Yes, she was taking oxytocin, and that is one of the main drugs. Different type of medicines plus injections at, say, specialist level. She had undergone. Mm, she was sleeping with a pillow between her knees, and she was getting relief after that particular position. Again, I'll tell. She was sleeping with a pillow between her knees, and after that, she was getting relief, somewhat relief from her low back pain. No night pain was there, but right sided constant low back pain was there in this particular case. So, coughing, sneezing was increasing her low back pain, and she felt around, say, 4 or 5 years ago, she fell on, say, her right buttock, and this caused her central to right sided low back pain syndrome. See, in erect posture, uh, there was, say, lumbar scoliotic changes were there, toe walking, heel walking were absolutely normal. Erect posture, and which was straining of left and right sacroiliac joints, respectively, which caused significant increase in right SI joint pain. It is a very particular type of pain. Lumbar spine ranges of movement were there. Active lumbar spine ranges were there. Say, everything, otherwise everything was normal, and there was no such finding related to any specific diagnosis. Sitting in, say, on in sofa, and bending towards forward position aggravated the pain on right side, right of, say, L5S1 and over right sacroiliac joint. So, right straight leg raising causes aggravation of pain. Say, supine SLR on right was limited. That is also there. So, these were some major facts. And other thing, she was having a history of, say, leukorrhea that was there, and so thoroughly we checked up with this patient. Sacroiliac joint stress tests can localize pain to a particular sacroiliac joint. No improvement, no improvement in SI joint pain following NSAID, following steroids, following, local acting steroid injections, at, say, at a particular point. She was given local acting steroid at, say, L5 level, but it was in vain. And after that, patient came to Ayurvedic treatment. Uh, Along with leukorrhea, he was having sacroiliac joint dysfunction. With a Faber test, it was confirmed. Nobody gave her time, includes very specialist doctors. Nobody gave her time only, and everyone gave her symptomatic treatment mainly for pain and local acting steroid also, but it was in vain. After say diagnosing sacroiliac joint dysfunction, again we started peculiar treatment for leukorrhea. Mainly we gave her Patha, Kutaj and Trikatu for Grathita Rajapravrutti. Along with that, we gave uh, medicines for her sacroiliac joint dysfunction, along with some local treatments, and patient got good relief from her symptoms. So this is the case of, say, male 49 years old, and this patient comes to us with past history of intermittent low back pain. He was there was no such particular history related to it. So present complaints were periodic low back pain since say 10 years, when he sneezed for the very first time, and after that pain started. He sneezed around say 10-11 years ago while bending forward and lifting. This painful episode caused caused him to spend around say 8-9 days in bed, complete bed rest. He was there. 2 weeks ago, again he developed severe acute low back pain, and for the first time, right sciatic pain with paresthesia in right foot and cold feeling in right foot. He tried many muscle relaxants along with NSAIDs, and after that he went to an orthopedic surgeon. After that he came to an Ayurvedic physician. So in this particular case, there was nothing specific. Symptoms had begun during say 2.5 weeks ago. He may have twisted his back getting in and out of the car. So that may be the reason of severe low back pain. That is what patient was under impression of. So because of acute low back pain and right sciatic with paresthesia in right foot, he sat on the chair on his left buttock with right leg extended in order to minimize low back pain and sciatic pain. S1, that is right ankle jerk, was absent, but other reflexes were normal. Supine SLR was also normal, but right SLR was compromised to 20%. So it was radiation into right buttock also. Active lumbar spine movements were restricted considerably due to LBP, that is low back pain, and increase in pain radiating into right buttock. So this is the case. Acute right-sided disc protrusion at L4, L5 and L5S1 level were there, and this was the case. So immediately patient was taken on complete bed rest. Along with bed rest, he was given immediately. He was relieved. His pain was relieved with the help of Rakta Mokshan, I will tell you about Rakta Mokshan on the fourth day for low back pain, and then immediately after say 6 weeks, not immediately, after 6 to 8 weeks, patient was again went for say radiograph or say X-ray, and patient the X-ray was all right before it was say intervertebral disc prolapse, but it was very acute and in Nutanavastha. Immediately we treated this patient, and afterwards it was reabsorption of intervertebral disc material also. So it can be possible. The answer is yes if it is within 7 days or within 8 to 10 days. Patient may get this type of results. So it is very important. When patient comes to you, is very important for new Vaidya also. Patient comes to us immediately. If we start treatment, that is better. See, uh, spinal surgery has its limitation even when all conservative treatments have failed. See, we are under impression that surgery is the ultimate thing in the world for say spine problems, but it is not so. Many a times, you may get say 50 to 60% you may be relieved with the pain, not to 100%. You may not get a complete cure after spinal surgery also. This is a male patient, overweight, 34 years old male, and having a great build. And he was smoking around approximately say 20 cigarettes per day, but non-alcoholic. But he was having daily 20 to 25 cigarettes per day. So unbearable low back pain, which was radiating posteriorly to left leg up to ankle, was there. It is sharp pain in low back. That is what patient was describing. Pain may awaken him in early hours, in the morning, early morning, or at night also. Uh, it was not deep-seated night pain, but there was pain. So he tried NSAIDs, he tried all types of painkillers along with muscle relaxants from his regular doctor, and then he comes to an Ayurvedic physician. Uh, he was given epidural block also, and but there was no uh, relief from any type of pain. So afterwards he was prescribed antidepressants also. So he didn't take that medicine. Uh, so uh, physiotherapy treatment, then acupuncture, pressure did not help him. Traction after traction, patient was complaining of burning sensation at L5 S1 level. So this was the case. Uh, he was unable to empty his urinary bladder, but bowel function was absolutely normal. See, coughing or sneezing did not exacerbate his symptom. Uh, very few times, sneezing was what we call it as exacerbating his symptom, but rarely. So, patient came to us, and first thing was his history. he had lifted around say 30-40 kg of say weight, uh, and he slipped and twisted his low back at that time, which caused immediate sharp pain in low back. Uh, he continued to work on light duties uh, for say about 2 to 2.5 months with this type of low back pain, and now it was very difficult for him to bear or to face this type of pain. He was having excruciating pain after this. So um, after that, they with no with every treatment he got no relief. He got no relief with anything, and his control over urinary bladder was increasing. His non-control was increasing, and after that he was having no control. And the result of spinal surgery was unpredictable. Even when patient sees a good surgeon, that then also it is not 100% result giving treatment. See, long term result of say a standard discectomy are not that much satisfying. That is what is seen in these type of cases. This patient has undergone surgery because after many efforts also, where we took many efforts for relieving this patient from pain, but it was in vain. Patient developed neurological deficit also. After neurological deficit, we were unable to treat this type of these particular patient, and we referred to him to an orthopedic surgeon, where he underwent surgery, discectomy, but the result was not that satisfactory. Also, result also was not that satisfactory. So these are some cases which we were discussing related to it. So it is a 33 years old obese patient and having no past history as such. Present complaints were low back pain, which was radiating to left buttock and thigh, towards the right also. It was there, but it was not consistent. Consistent complaint of low back pain, which radiates to left buttock, was consistent complaint. So buttock and leg symptoms occur on left and right side in varying degrees. Uh, then we can expect it is central disc protrusion. If it is left or right disc protrusion, it is very easy to treat these type of cases. If a patient comes to you on MRI, you can see that. If a patient comes to you with central disc protrusion, it is very difficult to treat this type of low back pain. Central disc protrusion is very difficult to treat. So there are n number of patients are there. One more case I would like to tell you about. It is he is a patient of say a male 20 years patient and having muscular athletic. There is no present past history as such. He was having severe muscle spasm, and that is the main. Just a minute, someone send me a question. should we give Vidyakarma in all these cases? Is it effective? For how many days it is a result remains? So we admit these type of cases for minimum for 5 days, maximum for 8 days. Within 8 to 10 days, patient gets relieved with pain. We start with Rakta Mokshan, complete Rakta Mokshan. That is the main thing, and may or may not give Virechan, and after that Basti we do in these type of cases. So I'll go along with the protocol also. I'll tell you more about protocol afterwards. So this is a 20-year-old young man, and see, in this case, MRI appears to be normal. In spite of it, patient was having history and physical findings suggestive of a disc problem. It is important to have clinical, what we call it as clinical suspicion, we can say, of internal disc disruption. So in this case, MRI was normal, but still we should understand that it may be a resultant of internal disc disruption. Constant moderate to severe low back pain, mainly centrally at L4, L5, S1 level. Where is L4, L5, S1 level? They below dimple. Below dimple, there you should free one angul below dimple, one angul. You can see L4, then L5, then S1. That is the level of L4. At the dimple level, it is L3. So some radiating pain was there at that particular site. To left thigh, posterolaterally down the back of left leg, with paresthesia in left foot. Coughing aggravates low back pain. Sneezing aggravates low back pain. Sneezing aggravates paresthesia in left foot. Walking causes increase in low back, left thigh pain. Long standing and sitting cause thigh pain. Sharp throbbing low back pain was there, and the pain was sometimes felt as sharp throbbing pain. Degree of pain, it causes him difficulties when trying to sleep, as he was feeling there is severe muscle spasm in left leg. Nerve conduction study was performed and it was normal at that point. See, this particular uh, pain was overlooked by all the doctors. Nobody took this patient seriously. He tried everything, say acupuncture, then bone setters, then he went to say orthopedic center. He went to everybody, physiotherapist, but there was no pain relief. Slight pain relief was there, but there was no pain relief in these cases. He felt central moderate low back pain before around say 2 to 3 months before he was felt central moderate low back pain. He thought that it may be a pulled muscle in low back pain, so he performed exercises daily, which he does normally. He was doing normally to keep him fit. That's it. This caused marked increase in low back pain and radiation down lateral aspect of left thigh, down back of left leg. Paresthesia at left foot. Um, then he was admitted at our hospital, uh, and the MRI was taken. And in this case, just a minute. In this case, imaging was very, very important. And after imaging only, after say MRI only, we came to know about this particular uh, diagnosis. Normal MRI study does not mean disc is normal. There may be internal disc disruption and annular tear may be there, which allows disc material to uh, to come out of to inflame adjacent neural structures. So, in this case, though MRI was not that abnormal, it doesn't mean disc is normal. Internal disc disruption and annular tear allows disc material to inflame the adjacent neural structures, and this is the main thing in this particular case. So, though MRI was normal, patient was clinically diagnosed as internal disc disruption and was treated very effectively only on the clinical basis. This case was explained to me by an orthopedic surgeon when this patient was admitted at Orthovid Hospital. We were unable to diagnose it very properly. So my sir helped him in this particular case. So if you understand thoroughly the exact position, exact rachanatmak vikruti, then anatomical deformity, then it is very simple to treat these type of cases. See, this is a case of 44-year-old slim man, good muscles, and he also was a smoker, around say 20 to 25 cigarettes per say around 8 to 10 cigarettes per day he was doing. He had fallen through ceiling 3 years ago, but he was not having any injury at low back pain, and intermittent low back pain was there. So what were the present complaints? Were severe backache, severe low back pain which was radiating to right buttock up to sole. So right buttock immediately to ankle since lifting heavy boxes at work 1 month ago. Walking up steps aggravated low back pain. On waking up in the morning, he experienced low back pain. Any cold atmosphere also aggravated low back pain. So every time he was wearing support belt also during winter, it was very much helpful. And it was keeping his low back warm. He also took many types of medicines, and sudden onset of severe low back pain, which came on while lifting heavy boxes, was there. And see, on deep palpation of paraspinal muscles, there was tenderness throughout lumbosacral spine and in right buttock centrally. So otherwise everything was normal. SLR was slightly compromised. Um Otherwise everything was normal. So imaging showed that this was spondylolisthesis, and there was no relief with any of the treatments. We tried many things like Katibasti, Anuvasan Basti, and whatnot, but it was in vain. Afterwards, patient underwent surgery where he was fixed with a cage at that particular, at that say L4 and S1 level, and then patient got relieved with the pain. Just a minute. Again, there is a question. Let me see. She's asking about, someone is asking about Viddha Karma. Is it effective? If it is acute pain, if pain is very acute and a radiating pain is there in Grudrathi, which is there many a times, so in that case, only Viddha Karma will not help. Daily Viddha Karma once a day during 25 or 24 hours, only Viddha Karma will not help her for from relieving the pain. If you want to relieve the pain, go for Rakta Mokshan, not Viddha Karma. In any specific medicine, in case of spine, I am talking about. If it is a small joint like say Kurpar Sandhi or say Janu Sandhi, then you can immediately think of Viddha Karma. Then you don't need say scalp vein or something like that. You can easily go with Viddha Karma, Agni Karma, which will reduce your pain immediately. Is any specific medicine yoga can be used separately for disc, ligament, bone, meniscus, bursae, etc., or for facet arthropathy? The answer is yes. Dr. Anup Vaishya has asked me this point. The answer is yes. I think I have covered it. I have cleared it in say in knee joint only, or in hip joint. I think I don't remember that, but in any of the joints, I have covered this particular topic. That Rachanatmak Vikruti or involved Rachana and its treatment. How to find out the treatment? That is what is told in in other joint study. But if time permits, we will talk on this in this chapter also. Just a minute. Again, there is one question. So there are n number of patients are there. This is perineural fibrosis, past history, low back pain while lifting heavy weights, Present complaints are constant low back pain and sciatic pain, recurred after discectomy and reoccurred after discectomy, and there was perineural fibrosis after the discectomy was there, and imaging was important. MRI was important after discectomy also, and it was a complication. And there is no treatment as such. Don't go for surgery or anything for this perineural fibrosis. Only thing you have to tell the patient immediately. See, now I will not go into details of these things. Exclude these. I'll go into these things. So we treated these type of cases. Leg length inequality is also one of the main key points. Every time, let the patient lie down and then you go for his or her clinical examination, and every time check for leg length inequality also. That is also very important. Anterior superior iliac spine to medial malleolus. You just measure its length. Both the limbs should be of say equal length. If it is inequality, then the low back pain starts. And so that is also very important. There are a number of pathologies related to it. What to exclude? First, this was these are some failure cases in my clinical practice. So I would like to share it. It is very important. It is very important that a senior doctor or an experienced doctor is motivating you. But what I will try to emphasize on that the failures, which is very important. Don't treat